Hi, Dr. Payne here. Men, I still have your back. We're talking about Men's Health 101 this month, and we're going to do it all month long with 5-minute videos. And today, what I'm going to talk about is cardiovascular health, the health risks with men. We're going to talk about blood pressure and cholesterol. So, in 5 minutes, you're going to learn how important it is for you to do annual screenings to screen for these risks and for these conditions. So today we're going to talk about the risk factors for cardiovascular disease in men, the prevalence and statistics. We're also going to talk about screening frequency and also commonly used tests and exams to screen you to see how you stand as far as your health when it comes to your cardiovascular risk. So let's start out with some statistics here, and I have it. I can post this too for you if you guys want a copy of this. But one of the startling statistics that I found was that it was on the CDC website, and it said that heart disease is the leading cause of death for men in the United States. Okay, how prevalent? It kills about 350,000 men, according to the CDC in 2017. So that's about 1 in every 4 males. And it is the leading cause of death in a lot of ethnic groups as well. So, that includes African Americans, Indians, American Indians, Alaska Natives, Hispanics. And so that's a pretty startling statistic. The other thing is about 1 in 13 white men and 1 in 14 black men have coronary heart disease. Half of the men who died suddenly of coronary heart disease had no previous symptoms. And that is the very scary part. Some of the risk factors. So when I was compiling this for you, I realized that the risk factors are very high, and there's a lot of them. Okay, so I'm going to read these out to you, so hold on. So if you're 45 or older, if an immediate family like your father, mother, brother, or sister was diagnosed with high blood pressure or some kind of heart condition before age 55, that puts you at risk. If you're African American, if you get little or no exercise, overweight or obesity, if you eat a lot of salty foods, or you add a lot of salt to your food, if your cholesterol is high. So usually if your cholesterol blood levels are 200 and higher, that's too high. That increases the plaque buildup in your arteries and all your blood vessels. Also, if you smoke, if you have high blood pressure, that puts you at risk as well for cardiovascular disease. If you're under a lot of stress, that's all of us. If you drink more than 2 alcoholic drinks every day, if you drink a lot of coffee, the caffeinated version, and also if you have diabetes. So more than 80% of people with diabetes will die with some kind of cardiovascular disease, with one of the most common cardiovascular diseases being congestive heart failure. Okay, so that's a lot of risk factors. So some of the tests, there's preliminary tests. So usually there's the basic physical exam where they listen to your heart, okay? And there's other parts to the physical exam, but also the blood pressure is taken. So usually the manual way of taking the blood pressure versus a machine is more accurate, right? They say that 120/80 is normal. That number does change from time to time, but around that is normal. Now, if you have a family history of diabetes, or you're getting screened and you're doing your annual screening, more than likely your medical doctor will screen you for hemoglobin A1C. So that's going to look at your blood sugar levels over the past couple of months. Now, when you have high glucose levels in your blood, it does put you at risk for damaging your blood vessel walls. So that also increases your risk factor. So that will be screened, your blood sugar levels. Also, blood tests, such as checking your thyroid. If your thyroid is overactive, for example, that's going to increase your heart rates, and that's going to make your heart work very harder. Urinalysis. Blood pressure affects many things, but one thing it does affect is kidney function. So that's going to be looked at. An EKG obviously will look at the electrical activity of your heart. So those are the screening tests. The frequency of screening is annual. So definitely every year you need to be screened for these things. So if you have any questions, go ahead and pop them into the comment section right now. And there's another thing I wanted to talk to you about. You may be asking, how do I reduce my risk of heart disease? Well, first of all, know your blood pressure. Okay, so you can buy a blood pressure machine, although it's not as accurate. It will give you an idea. You can get that off of Amazon. You can get it, I'm not endorsing Amazon, but you can get it offline. You can go to the store, you go to the corner store and get a blood pressure machine. So there's no excuse not to check it. You also want to talk to your healthcare provider about making sure they screen you annually to check for diabetes. And again, they want to do the hemoglobin A1C. If you smoke, you want to work on reducing your usage of smoking. Also, you do in your blood test, you also want to check for cholesterol levels and triglycerides. So the more fat that's in your bloodstream, the more it clogs your arteries, the more plaque is built, the more your heart has to work harder, and that increases your blood pressure. You also want to limit your alcohol use, okay? They say on the CDC website, limit it to 1 a day, okay? So you use your discretion on that. And also you want to work on lowering your stress levels, okay? So those are different ways for you on how to reduce your risk factors for cardiovascular disease. Remember, it is the most prevalent in men and the number one reason why men die every year. Now, if you know someone that can benefit from this information that I'm doing throughout the month of June, go ahead and tag their name in the comment sections below. And what I'm going to send to them is a chart, and it's going to have all the conditions that we need to make sure we stay on top of, okay, as far as screenings. It's going to tell you how often you should be screened and also what age your screening should start. So go ahead and tag. I hope you guys learned something. And the next time that we meet, we will be talking about, let's see. Okay, we will be talking about colorectal cancer and prostate cancer, which is very prevalent among men. Thank you so much. Bye.